initially we came in because the boys were both having what we considered the witching hour. Some people call it sundown syndrome. They would scream uncontrollably anywhere from an hour to 3 hours. And so Dr. Karen had talked about how the meridians can be off, and checking infants is really important. So we brought them in, and sure enough, there were several different things off with them, from their digestive system to their lumbars to tight muscles and their head area. And within the first adjustment, we noticed a major difference. Within a week, we weren't having the problem at all. So we've been coming every couple weeks for the last 2 months, and they look forward to the appointments, and they always seem to be doing really well after it.
So I'm doing craniosacral therapy, so I'm feeling the movement or the lack of movement in his first vertebrae, especially on the left. It feels really stuck on the left compared to on the right. So I'm holding my fingers there, and I'm just gradually and gently moving that top vertebrae. So with babies, I don't use a lot of force like you think of with adults, with like, you know, twisting, popping their neck. With babies, you just are gradually releasing, allowing the tissues to move better. So the tissues are really supple in babies. So it's really gentle. It's using about 5 grams of pressure. So now I'm going to go along and feel the rest of his neck. He's doing great.
Yeah, he's keeping an eye on me.
Yes, he is.
I'm here, buddy.
So now I'm feeling on the right side, down lower, there's a vertebrae about C5. It feels like it's not moving as well. It's actually sticking out a little bit. So again, we're going there, and we're allowing, it's moving better on the left than on the right. So we're moving it. And there he goes. We're moving it so to loosen on the right and move more from the right towards the left. Good. Yeah.
Okay, buddy.
So what that means is that by adjusting his neck, it helped to correct everything else down below, and helped to correct the bones in his head. So now I'm doing motion palpation. I'm feeling the movement or the lack of movement in his thoracic spine. Even though it tested better, it still feels like when we go along there's a vertebrae. There's a couple of vertebrae right here, right there, about T5, that aren't moving very well. Okay, so now I'm feeling a little rotation on the left side of his spine. It's rotated backwards on the left, so we're going to use the percussor on that. And then, so what I'm going to do is go to his sacroiliac joints, his hip joints in the back, and I'm going to move them. I'm going to move the left one, pushing it up, and the right one, pushing it up. We're going to see if it feels the same on each side. And the left one's the left one's where we've been working. You like that? And the left one still feels pretty stuck. So even though the percussor is an instrument that was designed for doing craniosacral therapy, and it's great for babies because it's really gentle.
You love
They
this.
love it.
Does it feel good, buddy?
So what we're doing is we're doing an adjustment with this. We're moving the joints, and we're moving the fascia, which is the thick fibrous tissue that covers the muscles and the nerves in the nervous system. So this allows us to move the fascia and to move the joint. So it releases the nervous system from the pelvis. So it's attached in the pelvis, it's attached on the spinal cord, and it's attached up in the head. with babies too, because he's spending a lot of time in this position now. And this is really an important time because when he's in this position, it's causing the curve in his neck and the curve in his low back to start forming. So we want to make sure everything's moving well and there's not stress on his nervous system. His head is the primary subluxation. So we're going to use the percussor in his head. It was designed by an osteopath to do craniosacral therapy to be used for the head. So what it does is, it's like a jackhammer. It goes up and down, and so it helps to set into motion the cranial bones so that we can gently and gradually realign them, and then taking the pressure off of the meninges, which covers the brain and spinal cord, and taking the pressure off of the brain and the spinal cord. So then his bones in his head can start moving better as he grows. It could affect his ears, ear infections, his hearing, his eyesight, neck pain, migraines, curvature in the spine, so many.
Do you see how excited he gets when he hears it? Oh, you love it, don't you, buddy? Does it feel good? Look at him. Yeah.
So I'm doing motion palpation, feeling the movement or the lack of movement in his thoracic spine. And there's a little bit up here. Okay, it's okay. So then we're going to lean it back and we're going to do little baby adjustment right there. And it actually popped. There was actually a little audible release. I can feel it pop. So now we're going to move down the rest of his thoracic spine. Yeah. And there's another one. So we're going to go right here. Yeah. There we go. Good job. Good job.
He smiles. Must feel good.
So interesting, his lumbar spine feels a lot more mobile and flexible than Charlie's does. Charlie's feels more stuck. It's interesting to be able to compare the two of them too. So right there. And then I'm going to use the percussor in his sacrum and his lumbar spine. Yeah. So when what I'm doing now is I'm lifting up on his sacroiliac joints and I'm feeling and comparing the motion between the right one and the left one. The left one doesn't move as freely as the right one does. So we're going to get in there with the percussor and we're going to get in there with the percussor and loosen it. We can show him squawking and then see if he...
Oh, there.
Oh, calms you right down. You need one of these at home.
Yeah.
Huh? So we're going right on his sacrum.
You like
And
that?
using the percussor to adjust the sacrum and to release the meninges, which is the covering over the spinal cord. And the meninges attach down here at the sacrum and at the coccyx, the tailbone. So we're also going to go up into his lumbar spine and adjust his lumbar spine with the percussor too. The lumbar spine is really important because the nerves that come out of the lumbar spine go to the intestines. And these guys have had trouble with constipation. So we want to keep the lumbar spine moving so that we can keep the bowels moving. Good.
Good job.
All right. Yeah. Good. You're all done. Great adjustment.
Good job.